Hey everybody, it's Monday. Happy New Year to everybody. It's been a long time since we've been in here. Monday is Murfreesboro. New guest. Welcome to the Doctors In Live with TOA. This is our time to give you information about what we do for you all. Again, my name is Gray Stallman. I'm your host. I don't know everything. I just try to help get the right people to you to give you some information. And so we appreciate your viewership. We appreciate your following. We appreciate your commentary. I hope that we're providing you with information that's interesting and important to y'all. As I hope you can tell, myself and everybody I've had on as a guest seems to really enjoy what we do, and we are passionate about what we do, and I hope that rubs off in the care that we give. Again, as with every episode, while we are both orthopedic surgeons, and we are not your orthopedic surgeons today, and so please take all the information we talk about today as for information and educational purposes rather than medical advice. If you have an orthopedic musculoskeletal medical problem, your best option to find some help is to go to TOA.com. You can see where we practice, what we practice, who we are, and we can find you someone to help you with your musculoskeletal needs. So I hope that if you've not needed TOA, I hope you never need TOA, but when you do, we're going to be here for you. So we have a new face today. This is Dr. Michael Jordan. Michael's actually one of the senior guys now in the practice, one of the old guys, kind of like me. We started about the same time. Yes. And Dr. Jordan has a unique perspective on things because he spent his entire, at least TOA career, and pretty much your entire orthopedic career as a sports medicine physician and particularly a sports medicine team physician. And we thought we'd talk a little bit about that. Your perspective, what it's all about, what it is, and what drives you to do that. So before we start having our conversation, Mike, thanks for being here. If you would just give people a little bit of an idea who you are, where you came up to this point, I think they'd like to hear that.
Well, greetings. My name is Michael Jordan, which the name in and of itself has helped in sports medicine quite a bit. It's kind of a hard name to forget. I grew up in Middle Tennessee in Donaldson and went to McGavock High School and then to Sewanee, played a little football at Sewanee, went to med school at Vanderbilt, did my residency in Augusta, Georgia, and then came back here mostly because of a guy named Tom Johns, who is a sports medicine legend in this area. He's the team doc for MTSU and all the high schools around. Somehow he single-handedly took care of all those high schools. And I had met him through a person who was a friend of my dad's who played football at MTSU, and he thought, man, that might be a good fit for you when you finish. And so I was actually able to do a month internship with him, or externship as a resident. We had rotations for a quarter, so I came and spent some time with him, and it was a really good experience. So that's how I ended up in Middle Tennessee. And I thought I wanted to be sports medicine or a team doctor. I had no idea what that meant. Other than I liked taking care of athletic type injuries, and those were the things I wanted to fix. Arthroscopy, ACLs, things like that. Wasn't really looking for the glory of the team doctor, but that's, of the surgeries that I did in my residency and training, that's what I wanted to do. But I had no idea what it meant to be a team doctor, and I was probably one of the last people who didn't do a fellowship in sports medicine. I did the Tom Johns Fellowship. So if you do a fellowship in sports medicine, you get a taste of what it's like to be a team doctor. Mm-hmm. All the things that go into it besides just the surgeries and the recoveries. But I gradually learned that, and as time went on, developed more and more of an appetite for how involved I wanted to be with team coverage. I will say being a team doctor when I started almost 30 years ago looks different than being a team doctor now, not from the time commitment, but from what all you take care of.
Yeah, I was going to say it must be way different when Tom Johns was by himself traveling the countryside, going to football games and whatnot all over the place, to what it is now. And a lot of people have kind of this impression that team physician is all about the NFL team physician, that kind of glory position, and that's one part of sports medicine, and it's a very isolated, kind of very unique situation as compared to what you do for the community, because you're really a community doctor.
Yes.
And a family of athletes who may be your friends' children or friends' grandchildren and things like that, as well as the parents. So give us some perspective about what it is to be a team physician in a community like Murfreesboro.
I think probably the NFL team doctor is kind of the pinnacle of team physicians, just like being an NFL football player is the pinnacle. But that's probably much less than 1% of the team doctors out there. Most of the team doctors are going to be involved at the high school level, the college level, and very much involved in their community. When I first started, and I learned most of what I learned from Tom Johns, you had to not only be an orthopedic surgeon, you had to take care of strep throats, you had to take care of dehydration, you had to take care of all kinds of things that teams would need you to take care of. Now we have primary cares who take care of the medical part. We have concussion specialists who take care of the concussions. When I first started, a young man or woman had a concussion, you were the concussion determiner whether they could play or not, and there was no pre and post injury testing to use to help have objective evidence. It was, do you feel good about that young person going back in or not? I knock on wood, I don't know of any adverse effects that I had or caused by allowing somebody to play or not play in those days. Common sense dictated a lot of it, but now we have much more specialized care of all the different things going on. So really my part is mostly musculoskeletal now. I can still sew up some lacerations. I can still prescribe antibiotics for things that I think are cellulitis or a skin infection or something like that, but I really defer to the primary cares for the medical part of sports medicine. And there is a whole medical part of sports medicine. In fact, you can go do a fellowship with Jim Andrews and be a primary care specialized in the treatment of sports medicine, medical, and non-surgical treatment of injuries. So, there's a whole field related to that. But where I practice and with the group of people that I practice with, and we have several physicians here that are team physicians, which is great because we have a lot of schools in our community. Mm-hmm. And it's hard to give 8 schools the attention they need with 1 or 2 people. You really need to have a lot of people to help that. So, I guess the first thing that we do is pre-participation physicals. And that starts the whole year off.
So this is the high school.
High school.
Yeah.
And we do it at college too.
Oh, you do? Okay.
In high school, we are part of the whole physical. In college, we only do the musculoskeletal part of it. But before the season kicks off for any sport, there's a Saturday here that TLA has for 25 years where we do every athlete in Rutherford County who needs a physical for free. I elicit the help from primary cares, cardiologists, surgeons, all different types of specialties to help us with that. And we'll run about 1,000 kids through here on a Saturday in a very well organized fashion in about 3 hours. And I feel like they all get a good physical. They don't get the physical they get from their pediatrician with the blood work and the absolute head to toe physical. But our job is to eliminate catastrophic death, to eliminate anybody who's unsafe to play, and I think we do a good job of that type of screening. So that's the first thing that I think that a sports medicine doc who's thinking about operating on people is not expecting to do is these pre-participation physicals. Obviously, there is the part of being a team doctor where you are the surgeon, you are the injury evaluator, you are the person who helps on the field decide can they return to play or not. In the office, can they return to play? Do they need surgery? Ordering the MRIs, potentially sometimes doing the surgery, following through with the recovery, and getting to see them go back on the field. And if you're actually there covering games, you actually get to see them play again, which I do with mixed emotions because you want them to succeed. You're nervous for them, probably just like their parents are. And then as the season goes and you see that they're going to be fine, you kind of ease up. But I don't think I ever go to a game where I know somebody's playing for the first time after their surgery that I don't have butterflies for them, just hoping that they do well. In between that is all the events that you can cover. And some people are more likely to cover events than others. I cover a game every Friday night for 15 weeks during football season. I cover a game every Saturday for 15 weeks of football season. I do a training room at MTSU and sometimes at Sewanee every other Sunday. I swap that out with one other partner of mine. So Friday, Saturday, Sunday during football season is significant game time coverage. During basketball season, we don't cover all the high school games, but we do cover the MTSU basketball games, and we have several people that help do that. So there's a whole lot of game coverage that goes into being a sports medicine doc that isn't very glorifying and doesn't pay a lot of money. And I think you gotta like sports to want to give up Friday, and you gotta have an understanding wife and kids.
Yeah.
or if you're a woman, a husband and kids that is willing to let you give up 15 Fridays in a row during the fall.
Now you travel with the teams that you cover as well?
We do not travel with the high school teams. We do travel with the college teams. The goal in our county, we have 10 to 12 high schools that we cover. We have 8 people who are willing to do that. You might have 1 or 2 people out on a vacation or on call, can't cover a game. So our goal is to make sure that we have a doctor from TOA at every home game in the county. And we do have a couple of doctors that are tied to one school and travel with them. But most of us kind of have a predominant school, but we have the goal of making sure that we have all our home games covered.
Rutherford County home teams are
Yes.
covered. That's
Yes.
awesome. That's awesome. How is it different I can imagine it's quite different in covering, managing, dealing with athletes, coaching staff, and whatnot on the collegiate level versus the high school level?
Yes. Probably the biggest difference is just the level of expectation at the college level and the number of bodies available to help. Each high school here has one trainer for all sports. During football season, the trainer probably spends most of their time during football. That's where the majority of injuries are, or the majority of risk of injury. So they're at every contact practice. At the college level, you probably got 6 or 8 trainers covering football, including the student trainers. So there's a whole lot more bodies there to help. The expectation of how fast an athlete is seen is about the same in both of them. Basically, 24/7 my phone is on. I might get a phone call from a coach or a trainer. Last Friday afternoon, for example, my son got out of school early. I got done with surgery early, and we went and did some outdoor stuff. Well, an hour into that, one of the MTSU athletes needed an evaluation. I took the phone call, as I always do, and was able to work out finishing what we were doing and see the athlete a couple hours later when we got home. But no matter what I'm doing or when I'm doing it, if I'm on vacation, if I'm out of the country, my phone's available 24/7 to the coaches and the trainers that I take care of. Not every athlete has my phone number, but they have access to me. And that was the Tom Johns rule. It was the Tom Johns-ism. It wasn't a rule. It was, availability is probably the most important thing in being a team doctor. Even if you can't examine immediately, do an MRI immediately, you can just give them some feedback on what we need to do and start that process, because I was able to go ahead and facilitate setting up an MRI over the weekend, and we were able to get an MRI done and determine in a timely fashion whether that athlete could go ahead and play this weekend or not. I think availability is really key. The high school athletes, they all have visions of playing college ball. The college athletes all have visions of playing pro ball. I think the expectations and the needs to get back in a safe manner, but as fast as possible, is the same at both those levels. College level programs, I think, are a little bit more prone to ordering MRI faster. I think nobody gets hurt on the pro level that doesn't get an MRI.
Right.
At the high school level, I think there's a little more discernment on the physician's behalf of whether you really need an MRI or not. I think that's a little bit different expectation. But as far as the availability and the response time and the return to play, I think it's about the same.
What have you seen in over your 25, almost 30 years now, right?
Yeah.
What have you seen the biggest changes in the athletic world with regard to training, conditioning, and whatnot, with regard to changes in injury patterns? And what I mean by that is, I seem to believe that because of increases in knowledge and technologies, we're getting bigger, stronger, faster, earlier. And I can only imagine that the level of injuries probably has changed to some degree over time as we've gotten more developed in our whole knowledge about how the body works, how physiology and kinesiology works earlier in life. Is that true? Have we seen a change in the types of injuries, the severity of injuries, these types of things that you're having to deal with? Or are people better trained and less injury prone?
I think there are lots of answers to that question. One is we're definitely bigger and faster, and the collisions are bigger because the athletes are bigger and faster, and that's two of them going in opposite directions. We've done much better at eliminating catastrophic spinal cord injuries. The concussion prevention strategies that have been put in place, don't lead with your head, also protects the spinal cord. And that had already started somewhat 20 years ago, so the number of spinal cord injuries has gone down dramatically through the years. I think there are a lot of other things that play into it besides size and speed. Playing surfaces. I think when we've gone to this synthetic turf, I think we're seeing less big knee injuries. The old turf that MTSU used to have, which was basically a thin layer of carpet on top of concrete.
Indoor, outdoor carpet on concrete.
I don't think it didn't give.
Yeah.
I mean, if feet stuck and knees ended up and ankles ended up taking the brunt of that. So I feel like the big numbers of ACLs is a little bit lower than it was in the older days. It's hard to imagine any surface is more forgiving than grass is, but I think as I've seen some of our high school fields go from natural grass to the synthetic grass, that we actually are seeing less injuries from the standpoint of the twisting and turning. Injury patterns to me seem to run, you will have a year where the injuries are down all across the board, and you just say we're having a really good year, and then you'll have a year where injuries are way up. And that goes for an individual team. You might have a team that has no injuries this year and then have 4 bad ones the next year. There's no doubt that we are bigger, faster, and the collisions are greater. I think, if I compare it to when I played high school football, the numbers of injuries are still significantly higher. I maybe saw 1 ACL, 2 ACLs in my entire high school career on my team, and it's much more than that. Some of that could be because we're playing year-round sports and we're not giving time off. There's a lot of pressure for a kid's going to get a scholarship or have a chance to go play pro. They got to do that sport year-round. There's pressure from families, there's pressures from coaches, and there's pressures from the athletes themselves because that's what they see. And we have indoor training facilities that allow people to do things year-round. And traditionally the year-round sports like gymnastics and basketball, they have more injuries. And I think like Little League throwers, the huge run of Ormaclow ligament or Tommy John's ligament injuries that we've seen are because they can pitch year-round. And Jim Andrews, who's a team doc for the pros, he's had this big injury prevention push for the last 10 years. And the biggest thing that he's found is 3 months off.
Time off.
Yeah,
time
time
off.
off. When you and I were kids, people played 3 sports. That was time off. That was cross training.
Right.
And now people don't. Very few athletes play 2 sports.
Right.
Most of them play 1 sport, and they're able to do it year round, and the body doesn't get any rest. I honestly think I've seen less injuries this year because of COVID. I think COVID caused some time off, and everybody said, well, nobody's going to be as in good a shape, nobody's going to be as strong. I just think it gave them some rest. I think we've seen less injuries. I know we saw less at the college level this year. Could be coincidence, but that's kind of what I thought maybe happened.
Well, I'm a big believer in that. I was never a team sport person myself. I was a individual endurance sport, so triathlon, running, that kind of thing, cycling. And it's true, the body gets damaged while you work out, while you play, while you perform. It needs to recover and rest. Otherwise, it becomes a chronic problem or a catastrophic problem. And so I think your point is well taken, that the body needs it. And that goes counter to the philosophy of, oh my God, the only way this person is going to get better to the top tier is if they're 100% all the time. And I think that's a tough balance. And of course, I'm sure you're in the midst of that, acting as kind of the psychologist too, because you are dealing with the medical problems, but you also know the medical consequence that can happen if we keep going down this pathway before stopping and taking a rest. And I can only imagine what it's like in between parents and coaches and team trainers and strength coaches and whatnot, and the athlete. That mix of people. You're treating a much bigger room than just you and the patient these days in your world.
Yes. And I have to say that, HIPAA made that tougher, which I approve of HIPAA and believe in it, but it was an easy conversation between a coach and a trainer who wasn't at the actual office visit. But now, you have to make sure that they're signed on to be able to hear. And I often will ask the player and their family, the coach is going to want to know, trainer's going to want to know, are you okay with me having that conversation with them? At the college level, all that's already signed. I don't ever have to worry about it. But at the high school level, you have to be cognizant of that. You could really get in trouble or offend somebody if you talk to their coach and had conversation that they weren't ready for you to have, or their trainer. But a trainer at every high school makes it much better from the standpoint of getting over a sprain or even post-surgery, because they can do the rehab on these athletes. So being able to communicate with them is very important. With the coach is naturally concerned about, are they okay, or they're not okay, but the next thing they want to know is, can they play or not?
Right.
So,
it's
that's
more black
information,
and white, yeah.
That's information that you convey on a piece of paper to them as well. But to the trainer who's doing their rehab, what do I need to do for this athlete? I just need to tape them, brace them, what can they do? Actually having, phone conversation is very helpful for that.
Is there any other points you'd like to make about the world of, and we're really talking about team physician. We were talking a little bit before we came on about sports medicine. If you have any comments about what your thoughts are on with regard to the role of sports medicine, as what people may think versus what it really is, and any comments about anybody out there who might have somebody in their life who wants to consider being a team physician. What kind of pearls of wisdom do you have?
Well, I think you gotta like sports. I can tell you that I can't watch any event from the stands anymore. I've spent my life on the sidelines. That's, it's very real on the sidelines. For a long time, my wife wanted to go to the Titans games, and I would go, but sitting in the stands uninvolved, I feel like I am part of the team.
Mm-hmm.
I'm an integral part of what's going on. And to that extent, you can be as involved as you want to. You can wear the team colors. You can ride, if you want to ride on the bus and go to the games. If you want to be friends with the coach, you can be as involved, or you can be as distant as you want to. I think there are times that I'm tired of going to football games on Friday. By that 12th week, I'm kind of tired of doing that. But I feel like it is a community service. Some people give their time in some ways to the community. Some people give their time, and I feel like that is a community service that I give. I try to encourage my partners that are comfortable doing it, because some of our team doctors are not even sports medicine doctors. We have hand surgeons, we have physiatrists, we have a spine surgeon. But giving back to the community is a good thing. And I think that we are all blessed, and we have a great practice in TOA, but especially in Rutherford County. And so I think giving back through sports participation physicals, showing up on sidelines, helping out is a great way to give back to the community. But I think it's something I had to learn a little bit at a time because I wasn't 100% sure I really wanted to do that. You know, and I did a little bit on Fridays and Saturdays, and I've gradually worked up to where I'm, the 15 weeks out of the year. That took a little time for me to do. Some people are able to just get right in the middle of it and love it, but maybe they get burnt out a little early and it's not exactly what they thought it was going to be, and that's okay. I would just say, the glory of sports medicine at the pinnacle is the guy in his scrubs talking to the press about the injury of the pro quarterback and whether he's going to play in the Super Bowl. But that's not real life sports medicine for me, and it's not for most people. It's, just being around people on Friday nights at a football game, and I've been here long enough that I'm treating the children of the people I treated. So, one of the running backs for one of the high schools I cover, his mom, I did her ACLs when she was playing basketball at the same high school, and I treated her mom, basically the grandmother. She was our unit secretary on our floor, the ortho floor. So for me, sports medicine is just a participation in the community, and the longer you do it, the longer you're there, the more rewarding it seems to me.
Well, it certainly is. When I was in residency at Vanderbilt, one of the sports medicine guys who came on board, his big philosophy was he treats everybody as if they're an elite athlete. And it really was a community-based, you treat everybody with the same problems in a similar respectful way, and you can get better outcomes, not saving your best work for the richest, most elite, or highest paid professional, for example. And it kind of stuck with me, and I've always admired the folks who do community-based sports medicine care, which is really, joint injury. I mean, that's really the biggest thing, some spine, but, it's mostly various joints that get boogered up, and you really are dedicated to the joy of athleticism, the joy of seeing somebody go from wishing they could do it because they're injured, now they can do it, and then you kind of let the baby bird fly and you send them off, nervous as you are, to achieve as much as they can. We're not making people superhuman. We're just bringing people as much joy to their lives and lifestyles as they want, and it truly is a community-based situation. You're far more amongst your community than a guy dealing with a pro athlete. I mean, you just are. Comparatively,
Yes.
Your practice brings you into the community. I think it's admirable. And again, as you've heard, it ain't glory. It's a lot of work, and it's a lot of time. And our folks here who really enjoy this, do this, love this, that's why they do it. And my hats are off to y'all for that.
I've always said, it's amazing how fortunate we are to have at least, I think 8 is the right number of people who are willing to give up a Friday night.
That's a big number. That's a big number. Because most of these people are young people with young kids and families and stuff like that, at least when they started out.
Yes.
And that's the way you were when you started, and it's a big commitment. So it's fun to hear the stories. And it's fun to see that, because I get the benefit. I get to see the parents and the kids later in life, for other things.
Yeah.
Even though I'm not on the field, I feel the buzz. Oh, Dr. Jordan took care of me when I was, and that's cool. I like that. I think that's neat. Anything else you'd like to say before we wrap it up?
No.
Okay.
Good. Thank you.
Michael, thank you so much. It's good to see you. Everybody, thank you very much. We will be back in a couple of weeks, February 8th. With Dr. Sean Brown, who's a hand and upper extremity specialist. We haven't decided on the topic yet, but Sean is here in Murfreesboro as well. She's a fantastic person.
And one of our team doctors.
And awesome. I'm not surprised. She's an athlete herself.
Yes.
And a beast from what I've seen in her CrossFit video. But I look forward to seeing y'all. And again, go to TOA.com if you have any questions. You're interested in finding out more about care for your musculoskeletal problems. We'll see each other in a couple of weeks. Until then, go out there and live your best life. Take care. Bye.